All right, guys, I am super excited today because I have kind of a big name with me. And he's been around for quite a while, since 2018. He's been making videos. He is an instructor. He runs a website. He runs TMC BootCamp. He's got over 2 million views on his YouTube channel, 287 videos as well. He is the RRT with the BDE, which is Big Diagnostic Energy. His name is Joe Lewis, and he is Respiratory Coach, and I'm thrilled to have him with me today. How you doing, boss?
I'm doing fantastic, Nick. Thank you for reaching out, inviting me on here. I'm glad to be here with you today.
Well, thank you so much for making the time, man. It means
I didn't know that about the 2 million views either. Shockingly, I didn't realize there was 2 million views on that channel. So that's awesome. That's really a testimony to the desire for all the students and the respiratory therapists out there. And it even extends beyond respiratory therapy, but it's really a testimony to the people's desire to learn and seek out information. And so I can put up 2,000 videos, but if nobody seeks them out to view them, then it's pointless. So big testimony to the viewers out there that have pushed that number up to over 2 million views. That's interesting to know.
That's a big accomplishment, man. That's awesome. 2.4 something million. Yeah. Very impressive. And that's one of the things I love about your channel is the quality of the information that you get from the videos. You go pretty in depth on some things and explain some complicated issues and complicated subjects, I should say, and make them a lot easier to digest. And the best part about it is it's free. That's
yeah. No, and that's the thing is with my approach to it is take these. First of all, respiratory therapy education does not have to be as complicated as a lot of times what it's made.
Sure.
And so I usually, my approach from the get-go has been to simplify the concepts down to the understanding, to the relatability of, the students who come in and you're trying to learn this complex, specialty in a lot of times 2 years. Whether it's an associate's degree program or a bachelor's degree program, you're still getting the respiratory knowledge in basically a 2-year window. It's a lot of information. And so, from the get-go, I've always tried to simplify it and be relatable and try to break down any barriers. So, whoever it is who is consuming the information doesn't feel like I'm trying to show off my knowledge. I'm trying to transfer my knowledge through, a digestible way that makes sense. And when it makes sense, then that's when the light bulb moments happen. The bad part about YouTube is that everybody watching, I can't see the light bulb moments when it happens like I can in my classroom. When I'm in my classroom, I can see the clicking points, boom. That just clarified something for somebody. And that's what I live for, is those light bulb moments. I wish there was a way that, YouTube should actually not just have a thumbs up, but they should have a light bulb icon where you can say light bulb moment right there. And so, because that's what I try to do is bring those things down, break them down to a simple level. And then, you take it back and use it how you need to be successful.
Absolutely. Yeah. And I think you do a great job of that. And I think that's why you've earned the over 2 million views. So when did you decide, and what kind of made you decide to start that YouTube channel?
Oh, this is a great story. I switched colleges back in 2018. So I was working out at a college west of Fort Worth, and then I transferred, switched jobs, came over to the main college there in Fort Worth, Texas, that has the respiratory therapy program. And when I came over there, I was one of my primary courses at my original teaching facility was pharmacology. Interesting story. When I went through RT school myself back in 1999 and 2001, I hated pharmacology. It was my least favorite course out of all the courses we took. And I absolutely hated it. And then I got a teaching gig, and they were like, hey, we want you to get ready to teach your first course next semester. And I was like, cool, what's it going to be? Like mechanical ventilation? Like, everybody wants the big dog classes, and they were like, nah, we're going to start you off with pharmacology. And I said,
of course,
right? And so I dove into it. I said, I'm not going to run from this. I'm not going to complain about it. I'm going to figure out how to teach it. at a level that makes sense to the people. And it took me several years to get to that point, but I finally feel like I cracked the code to where I can help it make sense, right? So fast forward to my new job that I go to, and now I'm not teaching pharmacology anymore. In my very first semester there, I'm having students rotate through my clinical rotation, and they're asking me, like, hey man, I'm asking them, I'm like, hey, what are you learning in class right now? They're like, oh my gosh, pharmacology, it's kicking our butts. Like we don't know, we can't, it doesn't make sense. And I said, oh, I love teaching pharmacology. I said, let me give you some tips here, right? So I have this thing where I can basically teach the entire semester of pharmacology in 60 minutes. And so I can hit all the major segments, write it down on a sheet of paper, one sheet of paper, boom, done, 60 minutes, the need to knows for pharmacology, right? And so I did it with them on a sheet of paper. I gave them the sheet of paper. They said, oh my gosh, that was amazing. Thank you so much. I said, now take this, make a copy of it, and give it to your other classmates, right? So the classmates, they go out the next week. I get a new group of students. They come in, they go, hey, Joe, will you do that pharmacology thing with us? And I said, I told them to give you a copy of it. And they said, oh no, we have a copy. They showed us a sheet like, oh, we have a copy, but we want to hear you say it. I said, okay, let's go. So I run through it, right? The next week, new group of students come through. What do they want? The same thing, right? So I repeated this same thing 3 times. And at the end of it, there was another group coming. The next week I had another group coming. And I said, I'm not doing this again, because believe it or not, your instructors are ready to go home at the end of the day also. And so, here we are ready to go home, and they're like, hey, will you do this? And it's like, okay, I got another hour here, when I've got kids and families, I'm ready to get home. And so after the 3rd time having to repeat it, I realized that there was value in people hearing the message, not just seeing it on a sheet of paper, but hearing it. And that's when I went home and I said, I'm putting this on YouTube. And that was my first video, was a pharmacology lesson. And I did that for that 4th class that was going to come through. I said, it's already available for you. It's right there. And that led to, them saying, oh, will you do one on this? Will you do one on that? And then as it started, I was, if you have any questions, you want me to touch on anything, let me know. And it just led to questions that are prompting clarification on more subjects. And it just snowballed from there. Very slow growth in the beginning. And then it just boom, 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 just kept going. And then, of course, the pandemic hit and everybody pretty much went to virtual learning. And it's funny because I can go back and I can take a graph of my YouTube analytics and I can see exactly when the pandemic started and when virtual learning happened, because it was just kind of like this slow growth, and then boom, everybody suddenly was now tuning in, and just kind of continued along since then. But yeah, it all started with just realizing that I'm having to repeat myself over and over and over, and understanding there's value in hearing a message, also seeing a message, but then also having the ability to replay it over and over and over, so that, when they're driving to school, they're listening to it. When they're driving home, they can listen to it again. And there's a big value in just being able to replay information over and over, especially when it's in short segments. So it's easy to find the things that you miss. And so that's kind of where it started for my students. They're the ones who started it for me. Funny story. My very first videos, they clowned on me a little bit. They gave me some Blues Clues, little figurines. They cut out some figurines at the end of their graduation because they said some of my videos reminded them of Blues Clues, when the guy was like, we just got some mail. Anyways, funny stuff.
I remember. Okay.
Yeah, funny stuff. But we had fun with it, and my very first comment came from an individual. I was so excited that very first day I got my first comment. I was like, yes, here we go. And the comment was like, can you explain something further? I don't remember what it was. And I went back to my class. I was like, guys, I got my first comment. And they said, who is it from? I said, it's from such and such. A guy named Daniel. I don't even know who he is or where he's from. And funny thing is, it was one of the guys in my classes. And but he went by a different name. He didn't go by Daniel. Daniel was his first name. He always went by his middle name. So I didn't know Daniel was his first name. So funny. He laughed. He goes, that's me. I said, oh, of course it is.
I think one of my first comments is from somebody I know on my video too.
Yeah.
But
it means a lot though. Comments mean a lot, especially that first one. Means a lot.
Yeah, Yeah, definitely. I remember that feeling too.
Yeah.
So speaking of pandemic and whatnot, what as an instructor, um, what was that like? Because I know for me, was I traveled, mainly was in the ICU around several different states. So that's I have that perspective, but I was kind of curious as an instructor, kind of what that was like for you. As much as you're comfortable with. I don't want to get political with it at all, just strictly medical, and kind of what you saw, what you see happening, the aftermath, I guess, that pros and cons, of what we learned and going forward, what that kind of looks like for us,
Yeah.
what you see perspective on.
Yeah. So as an instructor, it was interesting because there was a short amount of time when it all started. The hospitals didn't know what they didn't know what they were doing. Um, I, I honestly don't know if they knew what they were doing at the end of it, but at the beginning, they definitely didn't know what they were doing. They didn't know what was going on. Nobody knew where this was going to go. Right? Nobody knew how big it was going to be, how long it was going to last, the
Mm,
ramifications of it. Nobody knew anything, and so everybody was doing the best they could. So right off the bat, the very first thing was no students in the hospital setting. And so we got basically nixed out of the hospital settings for about 6 months. And then that lasted long enough to where the hospitals came around and they was like, look, like we still need respiratory therapists coming in and they're still gonna have to be trained. And so this doesn't look like it's going away anytime soon. And so they stepped back on that and they said, okay, now students can come back into our facility and take care of our patients, but they weren't allowed to take care of the COVID patients. So, and this is just in my area. I know it varies. I've talked to various different people about this. It was different in different places, but in my place, in my area of work, the students were welcomed back into the facilities, but they were not allowed to take care of the COVID patients,
okay.
which kind of eliminated me from being in that realm as well, right? Like I was, we could walk through the units, but we couldn't go into the patient rooms. So we did a lot of learning from the doorway, looking into the room, just seeing, talking about what was happening. Uh, but other than that, we were basically strictly, stuck in the non-COVID areas. And we continued to do the work through there. We continued to learn through there. We continued to teach, mechanical ventilation and basic therapies and all that stuff throughout the pandemic, and tried to give them a view of what was happening in those units when we could. Uh, but it was hard because you know out of a and I get it. The facilities were operating out of a place of caution. They didn't want to take the liability on of all these different students. And I teach at the biggest teaching facility in our area. And so it's not just RT students, it's also nursing students, it's also med students, residents, it's all the students.
Mm,
So they were operating out of what was the term back then, an abundance of caution to keep all students safe, and that was fine. It was sometimes hard for me because I had this feeling where I was seeing, when this happened, I had been teaching for 10 years, and so I had close to 200 students or graduates out here in my area that are out here working now, and I'm working alongside of them, and I see them going in and out of these COVID rooms, and there was a part of me that wanted to be in and out of those rooms with them. I wanted to be helping them. I wanted to feel like I was supporting the mission, but I was prohibited to do so by the rules that had been set up by the facilities as contractors, which is what we are as instructors bringing students in. We're contractors, so we had to play by those rules. And we still learned. The virtual education was tough because there was a time there where we couldn't do labs, and so you're trying to create, you're trying to do labs where you're learning hands-on skills, and now we're having to take that to a virtual realm where we had students, with blood gas kits, and they were having to practice on stuffed animals or bananas or oranges or different things like that, right? And so we had to get really creative in how we could continue to teach and have the students demonstrate the skills that they needed during that time. It was tough. It was very tough, and any student that went through it at that time will tell you like it was tough. But I will tell you that I've been very, very impressed with the students that went through that time of virtual education. uh, they've come out of it. and they're now practicing respiratory therapists, and they're practicing at a high level for the ones that I'm able to interact with. And I'm super proud of them because they didn't take it as a crutch that they're just going to hang their hat on for the rest of their career and go, well, poor me, I'm never going to be as good as anybody else because I went through it during the pandemic and all virtual education. I think if anything, what it showed is that virtual education can be effective when done the right way. And so when we think about need more RTs, you have to think about student flexibility and students' ability to get to campus and childcare and all these different things. And I think the pandemic showed that there is a place for virtual education in the world of respiratory therapy that doesn't have to be done the way we've always done it. It doesn't have to be synchronous, sitting in a classroom for 8 hours a day. And so I think it's going to open up some opportunities to make our field more readily available for other students out there that may have traditionally thought like, well, I can't make that work because of my schedule. And so I think it's a lot of positives that have come out of it. You just have to look for them. It's kind of the thing with everything.
What's the phrase? Desperation breeds creativity.
That's exactly right.
Yeah.
So, I think is funny because as I was going through my master's program I just recently completed, my project that my capstone project that I did was I basically took my class, I split them into two pieces, and I taught pulmonary function testing synchronously to half the class, and then I taught it asynchronously virtually to the other half of the class. So I didn't even talk to half of my class. I had no interaction with them for an entire week. And what they had to do was access these videos that I had created that was teaching them how to break down pulmonary function testing. The lectures were identical. Everything was identical. And then we all came back to class the next week, and immediately upon coming back, no questions asked, it's time to take an assessment, gave the two groups the assessment, and the assessments came out identical to one another.
Really?
Yeah. So there was no statistical difference in the in-person classes versus the virtual classes. They were identical, which for me shows that the knowledge can be transferred and can be obtained and digested if done in an appropriate and an effective manner. It's possible. And so, I think there's a lot of opportunity that's coming out of this for us.
That's awesome. That's something I never would have thought about. Yeah, it's the virtual learning part of that, but that's it's really interesting. That's really cool.
Yeah.
So going forward, I think there's definitely some pros that have come out of the pandemic. I guess if you can call them that, unfortunately, for what it was. Like I worked with a lot of RTs that were fresh graduates. They had just graduated and stepped into the field, and COVID was all that they knew. That was respiratory. And I think that in that sense, we've got a whole kind of generation of RTs that have already experienced as bad as it can possibly get, unless we have the pandemic, it's not ever going to get that bad. So I think, that's a pro. The virtual learning, that's definitely a pro. I think some of the cons are you can still ask just about anybody if they've heard of a respiratory therapist. And even if they say yes, they still really can't tell you what we do unless they directly know somebody. Or, I know people that are close to me that still have no idea what I do. And, I think we missed some opportunities there to educate during the pandemic. I think some leadership aspects. I think there's a lot to that, but that's kind of my take briefly. What else do you think about that?
Well, 100%. I mean, 100%. We missed the mark from nationwide exposure to be able to take during the middle of a respiratory disease process, pandemic. It missed the mark big time on seizing the moment for the time that we had a spotlight. We had a spotlight put on breathing problems for over 2 years, and still, when you looked at the messages that were being delivered and the people being interviewed, and I'm not going to say there were none because there were some, but it's still the number of RTs that were highlighted during this time was still very, very small in comparison to physicians and nurses that were showing up daily on, the different news outlets, and I don't know whose responsibility that is. I know somebody dropped the ball on
Sure.
on this, even if it wasn't through news outlets, even if it was a prime opportunity. And yeah, you're like, well, we were in the middle of a pandemic and everything was so bad and we were just trying to figure everything out. Yeah, but we still have to live and we still have to go on. And in those times is when you have to seize the opportunity to, like, boom, this is the time right now where some type of campaign to highlight and to show appreciation for and to just put us in the upfront space, to where people couldn't be ignored. I think there could have been done more in that realm. And like I said, I don't know who. I don't know. I mean, it's easy to point fingers. I could have done a better job. I mean, I had my channel going. I could have had another guest on every single day and said, "Talk to me about it. Let's talk about it." So I take responsibility as well. I just know, and it's traditionally as a whole, we typically drop the ball when it comes to seizing moments, and really promoting our profession to the highest level. I think if there's one area that we could all probably get better at, it is to motivate our therapists, all of our therapists, and all of our leadership and all of our organizations, to all of us say, you know what, why don't we go out there and really just show the badasses we are, instead of just sitting back and waiting for somebody to recognize it. So I think there's lots of different elements on that. I'll tell you another thing I want to talk about here, not just on missing that spotlight opportunity, which I agree with you on. Also, another thing that if we take ourselves, we can learn a lot from this pandemic. Case in point, there's a big movement, well, not really a big movement, but there is a movement out there where there's a lot of emphasis on devaluing low impact therapy. So what I'm talking about is therapy that when you look at patient outcomes, it's really doesn't really demonstrate much patient outcomes. So a lot of things that we do, all of these aerosolized medications that we do, right? There's a ton of them, and every RT will say the same thing, like, wow, man, we're like, half these patients don't even need this therapy, right? You've heard that said before. And not to be a negative, we're going to turn it into a positive. What happened during COVID? All the facilities that I'm aware of, what happened to all the aerosolized medications?
Zero.
They went away.
Yep.
They all went away. And what happened to patient outcomes? Nothing. And now that it feels like it's at least, I mean, it feels like we're out of it. It feels like we're coming out of it. If we really are not, well, only time will tell. But at least it feels like that.
They declared, sorry, not to interrupt, they declared on like May 6th or 7th that we're done with it. So
okay.
Yeah.
So now that it feels like it's over, and the mask mandates are going away, and everything feels like it's getting back. Actually, it feels like it's back to normal to me, honestly. Now here we are back delivering all these aerosolized medications, and I'm like, wait a second, why didn't we? Why wasn't that opportunity seized to say, wait a second, the pandemic proved to us that all these aerosolized medications are not needed. And here we are now bringing them all back. And it's a complete misallocation of therapy. And it's focusing our time and energy on things that do not lead to true patient outcomes. We're spending our time doing a lot of therapies that just aren't indicated. And that's where we really need to go, is shifting from those low impact therapies to really focusing our resources on our high impact therapies. Things like early mobility, things like early optimization of PEEP. During the initial phase of intubation, there's no better time to determine optimal PEEP than when that patient is sedated and paralyzed right after intubation, within the first, 20 minutes of initiation of mechanical ventilation. And we got to get to start focusing on those things, patient education to reduce recidivism. That's way more value than, an aerosolized medication to a pneumonia patient who doesn't even know why they're getting them.
Yes.
I would like to see I would like to see pre-spirometry being done before every therapy, before any aerosolized bronchodilator is given. And if the FEV 1% doesn't show an obstruction, then don't give that therapy. And that's the objective data that you need to relay back to your physician to say, there's no acute airway obstruction present here. This treatment is not indicated and therefore not given. Now, the flip side of that, real quick, Nick, is that you're going to hear respiratory therapists saying, who has time for that? Right? Like, but that's what we have to make the time for, because that's where the respect that everybody is seeking is not ever going to be gained just by doing whatever we're told and just stacking all these therapies and just doing as much as we can. We'll get the respect we're looking for when we start operating and displaying our critical thinking and the knowledge that we have, not for how much we can do. And so there's that little soapbox for you.
No. I to kind of piggyback off what you're saying, from working in a administrative position, I could tell you why we brought back all those therapies. It's to justify having us there and justify our time. And we, to kind of tie it all together, our time to shine and prove our worth was during COVID, and prove that we're here for things other than breathing treatments, and we can do things other than breathing treatments that will fill that time. That was the time to prove it. And, I think that's a lot of the reason why they're back is that, unfortunately. But, and, that all being said, I think that it's not that our chance is gone. It's that a good chance was there, a prime chance was there that we had, and we missed it. However, we still do have a chance to show just what we can do. And like you said, the badasses that we are. I mean, in every hospital that I've ever worked in, there's at least one or two therapists, if not the whole department, that are just complete. But you look at them, see the things they do, and everybody's like, yeah, that guy's a badass. There's always that one person at least. And, we can do amazing things. We really can. And we just have to be able to and have our scope of practice expanded. But we have to show that we're willing to do that and put in the work. Honestly, that's on us. And it does have to do with leadership, I think, as well. And I feel like historically the AARC, I know people complain about them, and I don't want to get on a soapbox about that. But I think, I would have expected to see somebody from that board or the NBRC on CNN, saying, hey, this is kind of what I feel like that was a really good opportunity for that. But again, it's still not gone. We still could do that, and the AARC does advocate for us. I just feel like it's only really on their own platforms, and they don't really push on the other ones too much. I'd really like to see that change. But I'd like to see other RTs come up too and do this.
Yeah. Well, I think that's why when I said, and I think you're right. I mean, obviously the spotlight during the pandemic, that spotlight's closed, but there's always a chance. It's never over. Yeah. There's always a new opportunity. And so 100%, you just have to find what that new opportunity is. And really, you just have to create your own opportunity. And that's why when I said, sure, could have been done more, I didn't highlight anybody else. I highlighted myself, as what I could have done that I didn't. And so, it's a lot of times it's real easy to sit back and look at and go, well, how come they're not doing more? And how come they're not doing more? And the truth is that, every RT could probably do more. If you want to raise the entire level of the industry, then raise it from the C up. And that's why when people, they look at their department and they say, well, we just need better leadership. A lot of people say, our leaders, how do you get this message through to our leadership? And what the message I send is the staff therapists need to recognize that they have the power because they have the numbers. If the staff therapist, everybody's looking at this, here's the problem. Everything is perspective. And so staff therapists are out here going, well, how come our leadership isn't doing more? How do you know leadership's not sitting back there going, how come my staff's not willing to do more?
Yeah.
You see what I'm saying? And so staff thinks it's a leadership problem. Leadership thinks it's a staff problem. And the truth is that these two have to come together and intentionally desire to start a movement to make things better, to create a culture in the individual hospital units, to create a culture in the individual school programs. And collectively, when all of that happens, then the entire profession starts to have a better culture. And we start to stand and rise up and have a little bit more pride in what we do, and stop looking for someone else to fix our problems. You want to fix your problems, just look in the mirror and fix whatever little problem you can fix. And I say that to myself as well. And so, I think it's an easy out to blame anybody else. I don't care if it's whoever. And and a lot of people say that. I hear that a lot. You're exactly right. Like, a lot of people say, well, what does the AARC do for me? And I'll tell you what they'll do for you. If you'll get a membership and you'll go into their CEU section and start reading the journal that they put out, you'll find that there's actually some really good data that comes out of that journal, and they'll give you a CEU for reading it.
Yeah.
So at the end of the year, when you're going out there and paying hundreds of dollars to get all your CEUs, you don't even have to be doing that. Your CEUs can be completely free if you'll take advantage of the organizations that are making them available to you. And so, and I'll be honest with you, I was that person at one time. I was like, I don't really know, and I have no affiliation with the AARC except that I'm a member, and I know a lot of the people in the AARC, but I don't get paid. I don't have any affiliation with them. Other than they're my national organization and I'm a member. But I was really shocked. I was like, you know what? People who say they don't do anything, or they have no value from them, are probably the people that have never even visited their website to go in to see what type of value you can get from them. Because there actually is a lot of value. You actually learn a lot. You just have to desire to want to learn, to go seek out that information, to dive into those articles and those research, that information, the evidence that you need to be a better respiratory therapist tomorrow than you are today. It's actually there. You just have to want to go get it. And so, again, perspective, you want it handed to you, or you want to go have to find it. And then you really start finding the value of everything. You look hard enough, you'll find out exactly who everybody is. And sometimes you're like, oh, I had this perspective about such and such, but after really infusing myself into it, I see that maybe that I was mistaken in my lack of perspective from the get-go. So, I think everybody's doing the best they can. I do feel like, in speaking about this, I will speak on this when it comes to leadership. I would like to see some bold decisions made from our leaders. I would like the cohort to seriously put in a strategic plan to get us to bachelor's level entry. Not because I devalue the associate's level degree. I mean, for God's sake, I teach at it. And so I don't devalue it, but I do think from an element of just collegiality and from talking to a lot of other people, the consensus is that we need to take our profession to the next level. Like, we need to take it there, to just boost our baseline level of who we are and what we can do. So I'd like to see that move done. I'd like to see the MBRC eliminate the CRT. I think, I know it's still out there, and again, no disrespect to any CRTs out there, but I think it's a industry standard that the RRT is the preferred credential to have to work in your facilities. And so in that case, I'm thinking to myself, why is the CRT even a credential that's still around? The answer to that is that you have to change state licensure and all that stuff, and everybody says that's too hard. But anytime I hear somebody say too hard, I think to myself, that's exactly why we should do it. Because it doesn't make sense for the level of difficulty. The harder something is, the more valuable the result will be. And so I'd like to see that. And then I would like to see the AARC make their clinical, safe clinical guidelines and staffing protocol or procedure outlet that they've identified. I would like to see them make that more readily available, where it doesn't come with such a steep price tag. I think that should be in the hands. Our national organization put together a guideline, a document that says this is what safe staffing looks like, and then you put a price tag on it that it's a high price tag. I mean, I think it's almost $400.
Yeah,
like that national organization should say, hey, we're going to lead our country in the right direction from a safe staffing and effective guideline standpoint, and we're going to put this in the hands of every facility, and we're going to promote you to follow it. Because that's what will lead to better workloads. That's what will lead to therapists having the time that they desire to spend with patients to truly impact outcomes.
I agree. And what you said about the AARC, I do agree with you. There is a lot of value in them. I didn't mean to criticize. I do mean to criticize them a little bit, but that's because everybody deserves it. I deserve criticism too. I could have started my channel during the pandemic and done something with it then. I should have started earlier. That's kind of my thing. Is I've done this for over a decade. That's a lot of time in there. I could have been doing this, and
right.
On me. That's on me. But I just meant to criticize them just as far as promotion during the pandemic and even after. That's really. But yes, you're right. If you go to the AARC's website, there's a lot of value there. You can learn a lot of things. But also through your videos, you have a ton of information that is concise and easy to digest, and anybody who's an RT or wanting to should definitely check out your channel, your website. The TMC BootCamp is a really cool thing that you've been doing. So
I appreciate that.
Yeah, absolutely. Yeah. Well, and thanks again so much for being here. I really appreciate it. I know you've got a class to go teach, so I'll let you get going.
All right, man. Nick, I appreciate you for having me on. I want to encourage you to keep doing what you're doing here with your channel, diving into some of these topics and some of these issues. Talk with as many respiratory therapists as you can, and inspire them and promote them to represent the field in a positive way. Share it with all of their families and friends, because we need more RTs. That's a big, that's the NBRC's campaign right now, morerts.com or needmorerts.com. And, it's true. We need more, but we really just need more quality RTs. And we need people coming into this profession that are going to be dedicated, prideful in what they do, and ultimately just take the very, very best care of our patients at the end of the day. That's all that matters. Nothing matters but that. We could talk. You could talk about whatever you want to. The only thing that matters at the end of the day is that you standing in front of whatever patient you are at any given time. That's the most important patient at that time, and do something for them that leads to a better outcome, even if it's just to make them smile, just make them feel better. That's the most important part about what we do, and that's the honor that you have and I have, and all the other RTs and all the future RTs have, is the honor to take care of sick, injured, hurting humans during their most vulnerable times. And we have to do that with a level of honor as well, and not just collecting a check, but really going out and doing it at a high standard, with a lot of empathy, kindness, and humanity. And that's my message, is just, do it with those three things in mind. And I think we do that and continue to do that. Things are going to continue to move in a trajectory for us that we're proud of. We look back at the end of our career and we say, you know what, I was proud to be a part of that. And that's the goal for me.
Yeah, absolutely. I know it's kind of corny, but kind of what I'm trying to do is be the change you want to see. That's what I'm shooting for, I guess. Again, I know it's a corny kind of thing to say, but it really is true. And yeah.
Well, I'm proud of you for doing that, man. Look, corny is corny. I mean, I say average is easy. Don't be it. I mean, it doesn't get any cornier than that. So, whatever. I mean, but you have to want to be the change. You have to, I'm proud of you for saying that. And you don't ever have to think it's corny or whatnot. It is what it is. And that's the motivation behind what you're doing. And I applaud you for recognizing that. Be the change you want to see, because a lot of people want to see change, but a lot of people are waiting for somebody to change it. And that's not going to happen. Nobody's going to change it for you. You are the only person that can change the trajectory of your profession. And the more you learn and the more you dive into it, I promise you, the more you'll fall in love with it. And I'm a living testimony of that. Because early on in my career, I was ready to get out of it. I was like, this isn't for me. I don't want to do this work. This isn't fulfilling. This isn't satisfying. And then something flipped in my head and I said, what am I going to go do? Nothing. So I said, let me own this. Let me own this space. And this was 10 years before the YouTube channel ever started.
Okay.
And started learning more about my craft, and started perfecting my craft, and started truly becoming an expert at the bedside and then in the classroom, and fell in love with a profession really for the first time. I don't think I ever loved it before, but I truly fell in love with it to a point today where my wife says, literally, Joe, is all you do talk about respiratory therapy all day long? And I said, yes, that's exactly what I do all day long, every day. That's what I do. And when I'm not talking about it, it's rolling around up here. What's the next step? What's the next play? Where's the next place of impact?
Just more is always kind of what
Yeah. You live it. And when you live it, you love it. Or maybe you should say, when you love it, you live it. And you still have time. I'm about to spend the whole weekend with my wife at a hotel here, just us two. So I'm going to get away from it, but it's still always there. It's part of who I am. And yeah, you want to be the change that you want to see. Be it, own it, live it. And can't wait to shake your hand one day, man. I hope to see you at a conference somewhere one day, and snatch a selfie with you, and throw you on TikTok.
I would be honored. I'm honored that you did this today, man. And thank you so much for the that's high praise. I really appreciate it.
Yeah, for sure. If I can, just real quick, if you're watching this and you want to know where to find me, you can obviously find me on YouTube at Respiratory Coach, TikTok at Respiratory Coach, Instagram at Respiratory Coach. You can always send me an email to respiratorycoach@gmail.com. And then on LinkedIn, I'm at Joe Lewis.
Thank you so much for watching the video, and a genuine, from the bottom of my heart, thank you to Joe for doing this. I genuinely didn't expect him to respond to my message, yet here we are. So seriously, Joe, thank you so much. Just a couple of housekeeping items, because this video is getting kind of long. We gotta name this panda, because I never did name it, and because you guys are some of the first subscribers to this channel, you have the opportunity to pick out the name for the panda. So if you'd like, drop a comment below on what you think a good name would be. And I actually meant to ask Joe what he thought, and it'd be really cool if he dropped his 2 cents down in the comments as well. But anyway, one other thing, I wanted to announce kind of an upload schedule that I'm going to be doing. For right now, every 2 weeks, I'll be putting a video out. So I'm thinking Fridays probably is going to be the best time to do that. So every 2 weeks, I'll have a video. And I do have some things in the works, some stuff I've been working on in the background, waiting on a couple of things so I can wrap up these videos, and I'll be able to post at least a couple here pretty soon. I would really like to do every week, but as of right now, it's just not possible for me. I want to get to that point where I'm able to crank out a video every week, but right now I think every 2 weeks is going to be realistic. And I'm going to be trying out a couple of different things to kind of see what you guys like, what I like, and try and find a happy medium somewhere in there. And I've got some ideas for the direction of this channel, but yeah, I haven't settled on one quite yet. So that's it for this one, guys. Thank you again for watching. Please like, subscribe, comment, all that stuff, and I'll see you on the next one.